thank you for coming back to my channel. And if you're here with me for your first time, I do videos on nursing, career, lifestyle, and a little bit here, a little bit there. So if you're interested in joining with me and learning new things, then stay tuned for this video. And don't forget to thumbs up. Don't forget to hit that subscription button and the bell so that you are notified for all my new videos that I have coming up. And if you are a subby already, thank you so much. Thank you. And I hope that you continue to stick around with me. So today, the topic that we're going to talk about is actually how to do well in nursing school. And I uploaded a previous video, and that video was how to get into your dream nursing school. So if you haven't watched that video, then watch that video and know some tips if you're trying to get into nursing school right now, or anyone who's trying to get into nursing school. But today, let's get into our video. So the first thing I can tell you is that these are all based on my personal experience, and by any means you do not have to follow these suggestions. That's all that they are, suggestions. But what I did to do well in nursing school, to be an active listener, and to also take good notes. So sometimes what you really have to do is you have to know what type of teacher you have. They have some teachers that are very hands-on. They have some teachers that just say the topics, say the information, and you just have to know which one is very important. And then they have some teachers that would be able to remind you of what are important topics. So you just have to be mindful of what teacher or professor that you have. Sometimes you'll know what notes to take based on if the teacher is repeating the same thing over and over. That's a clue to tell you that, hello, this is very important. Whenever a teacher tells you anything about any type of vital signs or any type of medication, certain things that you have to know as a nurse, that's very important for you to pay attention and to also take notes. So the next thing you want to do is that it's very easy to have someone speak to you and for you to listen. But are you really being an active listener? Are you able to really acknowledge what they're talking to you about and be able to process it in your head and say, okay, this is what the teacher expects me to know, or this is what the teacher expects me to do right now? You have to be an active listener. You want to make sure that you actually grasp the information that the teacher is telling you. And even with yourself, you have to pay attention to know what type of note taker you are. Do you learn more based on visual presentation? Do you learn more based on hearing it? Do you learn more based on writing things down? So based on how you learn things, that's how you should be taking notes. So if you're more of a visual person, you will either take a picture of what the teacher drew, or even draw yourself pictures that you have to draw in your notebook. If you are more of a person that goes based on what you hear, if it's okay with your professor, you can tape your professor while he or she is talking so that you can remember the things that you have to remember. And if you are more used to doing it by writing down stuff, then by all means write down or type your notes so that you're able to take efficient and adequate notes. The next thing you want to do is to ask questions and to also volunteer. So I'm not sure what stage you are in nursing school. You could be doing, if you are in fundamentals or foundation classes, you want to be able to ask questions. If you don't understand a certain topic, or you need a teacher to repeat over again, or if you even need to have a one-on-one session with your teacher, let them know. Communicate with them. Ask questions. It's not anything. Is nothing wrong with asking questions. No one is going to label you, and no one's going to talk about you. And then if they do, who cares? It's for you to learn. You want to know certain things, because I'm sure you want to be a very good nurse. Another tip would be for you to study like crazy. You need to study times infinity when you're in nursing school. And the reason why, for me, why I wanted to study is because I wanted to be the best nurse that it could possibly be. I'm like, even up to this day, I'm always reading up on something to just try to know how I could do something better or how I could improve my performance. I want to always be 100% the best person that I can be. Another thing is that while I'm in school, I don't want to say the wrong words or the wrong answers, or I want to be knowledgeable about my topic, especially as an RN. One of the things that you would do as an RN is to provide teaching and education. If you don't know the topic, how can you provide teaching and education? And how can you be accurate of what you're telling other people? You want to not question yourself. You want to make sure that you absolutely know that the information that you're giving a patient is accurate. So study all the time. Practice your care plans. Practice your nursing interventions. Practice and come up with different options of what your nursing interventions could be. Practice nursing diagnosis. You want to just know all those stuff so that if you are ever in the situation that you have a patient who fit a certain diagnosis, that you want to be able to have the certain interventions to help them achieve a better outcome. Till next time. Oh, wait. Before I go, I want to let you know, for all my new nurses or anyone who's interested in becoming a nurse, there's this website. I'm going to list it down in the link in the description, but it's called allnurses.com. And if you don't know about it, it's a very nice nurse website for nurses. And whenever to this day, if I have anything that I need to know about, that's the #1 website that I will go to try to get a feel about what's going on. So in that website, any nursing school, nursing students, professional nurses, anyone could go to that website and you can learn new things. You could meet new people. You could join a study group there. You could get more information about a certain school. So if you want the 411 on nursing, that's the website you could go to. Bye.